This is a video in clinical medicine from the New England Journal of Medicine.
This video will demonstrate safe and successful methods of performing lumbar puncture. Lumbar puncture is indicated for both diagnostic and therapeutic purposes. Also, the administration of spinal and epidural anesthesia involves the use, essentially, of this same technique. Analysis of cerebrospinal fluid may be helpful in the diagnosis of infectious processes such as meningitis, inflammatory diseases such as multiple sclerosis, cancers such as leukemia, and metabolic processes. Therapeutically, lumbar puncture allows for the intrathecal administration of chemotherapeutic agents and antibiotics. There are specific contraindications to lumbar puncture. The condition of patients with cardiorespiratory compromise may worsen as a consequence of the position they need to assume for lumbar puncture. The procedure should also be avoided in patients with signs of cerebral herniation, incipient herniation, or increased intracranial pressure, and in those with focal neurologic signs. In such patients, cranial CT should be performed before lumbar puncture, although CT may not reveal signs of increased intracranial pressure. Finally, there is an increased risk of a spinal hematoma if a coagulopathy is present or if the patient is receiving anticoagulant therapy. Patients who have previously undergone lumbar surgery should be referred to an interventional radiologist. Before performing the lumbar puncture, you will need a commercially available tray containing the necessary supplies, a spinal needle with a stylet, equipment for skin preparation, drapes, collection tubes, and in some cases a manometer. Typically, a 20 to 22 gauge needle is used, with the length ranging from 1.5 inches or 3.8 centimeters for infants to 2.5 inches or 6.3 centimeters for children and 3.5 inches or 8.9 centimeters for adults. You will also need sterile gloves. Before you begin, you should explain the procedure along with potential risks and benefits to the patient and obtain informed consent from the patient or his or her parent or guardian. After obtaining appropriate patient consent, the patient is positioned. Either the lateral recumbent position or a sitting position can be used. The lateral recumbent position is preferred to obtain an accurate opening pressure and to reduce the risk of post-puncture headache. Instruct the patient to assume a fetal position or to arch like a cat with the back flexed. This position widens the gap between the spinous processes. Ideally, the lumbar spine should be perpendicular to the table if the patient is in the sitting position and parallel to the table if he or she is in the lateral recumbent position. These positions help keep the needle at the midline. A line is visually drawn between the superior aspects of the iliac crest and intersects the midline at the L4 spinous process.